How are you, students? Today a new topic, 69, disorders of adult personality and behavior. Так, etiology. Firstly, main features of this chapter, F60, I wrote in short, 69, it is not mistake. Etiology. The etiology, these disorders maybe has hereditary origin, maybe we find information about suffering among relatives of this person, maybe formation during childhood and adolescent period. We can find different problems during upbringing, for example, maybe problems, deprivation, frustration, very bad influence of this child, and then formation. For example, social families in our countries, there are some people has very, very bad situations in the family. Children very often suffering from different problems, from eating, maybe from care and so on, maybe aggressive attitudes among parents, maybe bad influence, and then formation negative attitude to the life and demonstrate disorders, behavioral disorders. This topic characterized by pathology of character and control above impulses. All these disorders, which included in this topic, chapter F6, characterized by these points. It is pathology of character. You must understand that intelligence not suffering here, to is intelligence or intellect not suffering. Next, stable condition during all life. If formated this pathology of character, this pathological character continue all life of the person. And deviation of behavior. At firstly, in clinical picture, we see the behavioral disorders. Structure topic or chapter 69. First, specific personality disorders. There are, you see, many kinds. There are due to the ICD-10 eight number of the specific personality disorders kinds. Then enduring personality changes, not connected with organic pathology. Then habits and impulse disorders. Next, gender identity disorder of childhood, disorders of sexual preference, and elaboration of physical symptoms for psychological problems, and intentional production or feigning. If you remember, we had practical class simulation of symptoms or disabilities. Now, talking about first topic in this chapter, diagnostic specific personality disorders. These types of states are robust form of behaviors. They are usually extreme or significant deviations from those generally accepted in this society. Now, for example, in your country, you have your cultural traditions of behavior. In our country, another cultural traditions, for example. Maybe in your country, you have many laws, and you don't take, for example, in some regions, alcohol. In our country, it is a law, and adult can take alcohol traditions, maybe in the meeting and so on. And if in your country, for example, recently days, I listen in the Maldives, the absent taking alcohol. If a person take alcohol, it is maybe caught solution and prison. It is very, very strong attitude to the alcohol abuse. In our country is not very strong attitude to the alcohol abuse, no, but we have law when drivers in the transport, any driver own car or maybe bus or so on, they can drive without alcohol intoxication. If person take alcohol and during driving, the policeman stop and finds the alcohol intoxication, it is maybe sanctions, maybe bad complications, maybe court, maybe not court, maybe money. The person must pay money first time, then if case repeat, maybe this person lost certificate to be driver, for example. No, there are many maybe attitudes, for example. That is, in some countries it may be alcohol intoxication, maybe deviations, I want to say. In our country it is not. For example, deviation. But if during alcohol intoxication person do accidents, broke the windows in the stores, aggressive behavior to the people in the street, it is deviations. It is deviations. Так, next, they are stable and cover many areas of behavior and psychological functioning. This character is stable and usually this deviant behavior continue all time, every time, maybe in the job, in the family, in the any places, maybe, for example. Так, they are often but not always associated with varying degrees of subjective distress, suffers from consequences, but cannot change his behavior. Now, this point to say that this person can have subjective distress because after different maybe aggressive actions, he has problems with policemen, with my neighbors, with families, for example, but cannot change his behavior. Deviant behavior not learn this person to change the behavior. He understand or she understand. No, usually personality disorders more often suffering men in many countries. They sometimes understand they have deviant character, they have problems with character, they have problems in the behavior, but cannot change and repeat these actions, not due to the law. Personality disorders begin in childhood or adolescence and continue into adulthood. No, in the first slide, I was talking about this when very bad, maybe bad upbringing, maybe problems in the family, maybe child lose parents and then upbringing among another relative, maybe when child has negative attitude from adult and so on, maybe formation this personality disorder. Not in all cases, but in some cases, maybe formation. Next, they differ from personality changes. Please not mix personality disorder and personality changes. It is different nosological form. Different nosological form. They can precede and comorbid with other disorders. No, for example, personality disorder can comorbid with alcohol abuse, narcotic abuse. Usually drug abuse we observe at the people with personality disorders, usually. Next, personality change is usually acquired in adulthood after severe or prolonged stress, extreme environmental deprivation, a serious mental disorders, illness, or brain injury. I repeat, personality changes. It is another nosological form. If it is brain injury, we observe this disorder at the F0. You remember organic personality disorder, because we see personality changes. If after environmental severe deprivation, after prolonged severe stress, we write personality changes. Then you understand in the future. Так, forms. Значит, personality disorders, they have 8 forms, you see, and 9 form it is mixed. 8 form due to the main signs of this disorder. For example, paranoid personality disorders. It is not means this person has delusion, no, but he is very, very like to find different mistake among people. For example, very, very read many orders from government. He tried to establish orders in the region where they live, for example, in the house, maybe large house, garden, and this person built relations between neighbors very, very strong and so on. It is paranoid. Maybe sometimes not understand another person, very maybe aggressive during verbal aggressive, maybe during conversation, during relationship, for example, with neighbors, maybe. In other people, maybe on the job, maybe very paranoid, то есть perceive another actions of another people very, very strange and so on, and discuss about this. Schizoid personality disorder. Schizoid personality disorder, like people which want to be alone, usually they are introvert, they like to be alone, they have isolation, they not communicate with other persons, for example, maybe have strange behavior, not contact, not like to communicate, and usually check the job without any communications. Maybe some programmist, maybe librarist, maybe job when without any context. Dissocial personality disorder, it's very deviant personality disorder because the companies characterized by severe symptom signs, for example, cynicisms, absent empathy to another people, not for example, don't like the different governments, states, orders, rules, for example, they make many aggressive actions. Usually they have fights, for example, during life in the years. Then they very often make maybe accidents, they have alcohol abuse, they have contact with policemen and make different crimes. Emotionally unstable personality disorder, emotional unstable, or remember, for example, the behavior depends from emotions. Now, good emotions, they are very cheerful, alike, and talking, communicate, and so on. The mood is not good, for example, decreased mood. Today, they are maybe aggressive, and so on. Usually unstable, they don't like to job, they don't like go to the help to another people, to parents, for example, to family. Usually often they distorts with 5, maybe some distorts, not one distorts, maybe 2, 3 distorts. They not help to the children. They like the life without any responsibilities. Then histrionic personality disorder, histrionic or hysterical. In some cases you find terminology hysterical personality disorder, usually predominates at the woman. They like to be in the center of attention. They like to dress very, very with color, different colors, red colors, and so on. To be in the center of attention, like to be that another man look at this woman, for example, like to dance, to go to the restaurants and so on. To is life, this free life, and don't like to be at home, to do washing, cleaning and so on, to upbringing the children. And usually they have every time conflicts. If they are married, it is conflict with husband, with children, with parents, because she tried to be in the different places with friends, in the job, with colleagues, restaurants, and so on. Next, anenchestic personality disorders. Anenchestic, it is usually from childhood formation, maybe from born, people which suffering with increased anxious and very many different obsessive doubts, for example, imaginations, remembering, and so on from childhood. They very, very anxious. Identical to 7-point UC, anxious personality disorder, and usually accompanies predominance different obsessive doubts, obsessive thoughts, obsessive maybe compulsive, maybe actions. Anxious personality disorder, predominant anxiety. So is afraid before different problems, has anxiety before how he go to the school and decide the mathematics, maybe module, for example, very has anxieties, problems with sleep, eating, and so on. Every time anxiety before cases which now is absent. For example, experience before what will a new president, what will be with country, what will be with family, what the, for example, children they do in the school and so on. So it's every time has experience, anxious experience. Next, dependent personality disorder. This person usually we observe in the maybe family. For example, when adult child depends from parents and cannot live alone, dependent personality disorder. And often maybe in the family, for example, young woman cannot divorce with husband because she has dependent disorder and cannot divorce. Husband has very bad attitude to this woman, to his wife, fight her, for example, bad attitude, aggressive maybe attitude, but this woman don't want to divorce because not image the future life without this man, without this husband. It is dependent personality disorder, and she continued to suffer from trauma, from influence bad. It is dependency personality disorder. Many people around, for example, friends, her relative, mother, father, said her divorce with his husband, but she not agree because she sure only with this man she can continue to live. And mix. In the practice, very difficult. You see in the world there are many populations, and we cannot all people to differ on this only 8 points, for example. And in our practice, in psychiatric practice, often we see in the one person combination different signs of different points, different types of the personality disorder, and usually we can write it as mixed personality disorder. Next topic in this chapter, F60, enduring personality changes, not attributable to brain damage. If brain damage, we write F0, organic personality disorder. Here, not connected with brain damage. This group includes disorders of adult personality and behavior which develop first developing after catastrophic or excessive prolonged stress, and second form after severe psychiatric illness, in people without previous personality disorder. То есть, that is, human was healthy, for example, then he has severe psychiatric illness. After recovering, because he remembered what was happened with him, he was in the psychiatric hospital, he's suffering and appear personality changes. For example, what you see table, 2 box. First box, it is enduring personality changes after catastrophic experience. You see the examples in what situation can, not in all cases. Some people recovering very normal maybe. Personality changes maybe after concentration camp experiences. Maybe you read historical novels and so on about different war in the world. You know what is a torture, after torture maybe arising. Next, disasters, after disasters, natural disasters, maybe technical disasters, very shock maybe after that, and then appear different symptoms. Prolonged exposure to life-threatening circumstances, for example, you see hostage situations, prolonged captivity with the imminent possibility of being killed, and so arrest, for example, in another country when person cannot know the language and so on, alone, for example. There is different maybe situations. Enduring personality changes after psychiatric illness. I said before, develops after clinical recovering from mental disorders, which was emotionally extremely stressful and shattering for patients. It was, I repeat, severe mental disorders, maybe psychosis, maybe acute stress reaction, acute transient psychotic disorder, if you remember, when person had psychosis, maybe after severe stress, and was admitted to psychiatric hospital and remember these situations, after that recovering, but he has experience with this treatment, with this in the hospital, contact with another patients in the hospital, then think about the many people, colleagues, neighbors, then relative another know about his treatment in the psychiatric hospital. You understand it is a present situation of stigmatizations. And because this person have auto-stigmatization arising this enduring personality changes. This person is confused, lose contact with, for example, friends, live only with family, and so on. It is enduring personality changes. Here more you can read main diagnostic guidelines. For example, after catastrophic experience, it is diagnostic science. If we have this science, we can write this diagnosis. It is hostile or mistrustful attitude towards the world, social isolation, feelings of emptiness or hopelessness, chronic feeling of being on edge, as if constantly threatened, usually duration at least 2 years, and we must exclude personality disorder and exclude presence of brain damage. After that, we can write it is enduring personality changes. First we must find information about catastrophic. After psychiatric illness must be next diagnostic signs, dependence on and demanding attitude towards others, social isolation, identical, passivity, pessimism, reduce interest, decrease activities, persistent complaints, dysphoric or label mood, maybe aggressive, maybe good mood, then bad mood, significant impairment in social and occupational functioning compared with the premorbid conditions. It is diagnostic signs of personality change after psychiatric illness. I repeat, maybe acute transient psychotic disorders, usually after that. Maybe disorder with psychosis, for example. Continue again, period, duration, 2 years or more. Exclude damage of the brain or another severe disease, somatic, and exclude previous diagnosis of schizophrenia. We must exclude. Next topic in this chapter, F60, 69, habits and impulse disorders. They are characterized by repeated actions that have no clear rational motivation and that generally harm the patient's own interests and those of other people. No repeated actions you understand in the future when I will talking about different types of these actions. The patient reports that the behavior is associated with impulses to action that cannot be controlled. In every time, the patients cannot explain why they did these actions. Or they say that cannot control. They not control. The causes of these conditions are not understood. The disorders are grouped together because of broad descriptive similarities. In sometimes we cannot find the concrete causes, etiological factors, for example, and patient cannot explain, and for example, relative cannot explain, for example, why this person did these actions. And sometimes we cannot understand why. But it is the behavioral disorders because it is actions, negative actions for himself, for another people. Now, for example, you see on the pictures habit and impulse disorders. It is gambling, you see, for example, casino and so on. In our country now, official casino is absent, closed. In many situations, for example, I remember in the Moscow, in the Russian closed casino, but in some countries, many casino is open and some people go to the end. Some people, not all, but some percent of the people suffering with gambling. Pathological gambling. Gambling may be not pathological when person goes, then stops, then back at home, for example, continue to job, then again come to the casino, to is periodically visit the casino, but she can stop and not continue to play. Pathological gambling. The disorder consists of frequent, repeated episodes of gambling which start to dominate the individual's life to the detriment of social, occupational, material, and family values. То есть by time, if it is pathological gambling, this person forget about his responsible before occupation, before colleagues, before family, for example, lose this contact gradually. Difficult to control. The person cannot stop. For example, he lose time but cannot stop. Then preoccupation with ideas and images of the act of gambling, and these preoccupations often increase during stressful situations. During game, usually these preoccupations increase. Next, pathological fire setting. No, previous slide, for example, predominant at the men, usually men suffering with this, but in some countries, European countries, American countries, maybe women. And usually maybe bad termination, this men lose all contacts with friends because by time this person come and ask money again, and time when arise when anybody, parents, friends, wife, children, and so on, and they say stop, we have not money, and then maybe distorts with family and so on, and in some cases very bad terminations. The person maybe stay alone in the street. No, it is one of the way. Так, next, pathological fire setting or pyromania or pathological fire setting. It is disorder characterized by multiple actions of or attempts at setting fire to property or other objects without apparent motive and by a persistent preoccupation with subject related to fire and burning. No, in short, you see on the picture and so on, usually suffering boys and teenagers and adult men, usually predominates in the men. They like to look at the fire. They, for example, if little children, he fire different objects at the home, maybe conflicts from mother, father. Then more older in the school period, he with children maybe fire another object in the street, for example. Then maybe if it is not, if very responsible, this man, he checks the job touch with fire, for example, which firefighting equipment, for example, fire engineers, for example, go to this fire service, go to the job. Now, very important profession, it is pyrotechnics. Pyrotechnics, it is used in the, for example, when creation of new movies, now many detective movies, yes, and they use many fires actions during accidents, car, maybe technical accidents and so on. And usually this who like very like to fire something, they check these professions. In some cases, maybe bad termination, for example, maybe after fire, maybe spread the fire on another object, maybe problems, contact with policemen, and so on. But you must understand this in the pathological fire, the person like to look this fire, then before firing, he has very internal feelings, tension. During fire, he has very good conditions, for example, and satisfaction. It is it is pathology of desires. Pathological fires, pathological gambling, it is connected with pathology of desires. If you remember from psychopathology, it is volitional spheres. Why? What the etiological factor of fire setting? It is unknown. This connected with centers maybe in the brain. Diagnostic science, for example, must be repeated fire setting without any motivations, such as monetary gain, revenge, or political extremisms. No, you see now many situations. Sometimes you see it is maybe political extremisms. Yes, you see maybe monetary gain, different maybe situations. So in every actions we must identify it is pathology of desire or it is maybe crimes. We must differ. Next point, an intense interest in watching fires burn. And what I repeat, feelings of increasing tension before the actions, then intense excitement immediately during, and feeling of satisfaction after. It is a characteristic of pathology of desire. Next, pathological stealing or kleptomania. Kleptomania. The disorder is characterized by repeated inability to resist impulses to steal objects that are not acquired for personal use or monetary benefits. The objects may instead be discarded, given away, or they are hoarded. No, you see, for example, on the picture, young woman, she is normally, for example, good dress, clean dress. It is not woman very old or maybe with disturbances. No, she tried to take one box, little box, and look around. She like only processes of the stealing, only processes. What you see next point. Increasing sense or feelings of tension before, sense of gratification during, and immediately after the act, to satisfaction. It is they like only processes. They don't steal the very expensive objects, for example, brilliance or maybe money, for example. No, they maybe steal a little object, maybe what one box, I don't see what is it, maybe little box with something maybe not expensive, but only they like processes of the stealing. They, for example, sometimes we can see in the news one very famous actress, I don't remember her name, she was admitted to the policeman because in the stories he has still some dress, not very expensive dress, but she took this dress and without payment ran away. So it's only processes of stealing they have interest. The theft is individual actions not carried out with an accomplice. No, usually stealing, yes, stealing usually they make alone without any friends or people and so on. Next, gender identity. Before on the lecture, I did not say, but you please read on the class practice trichotillomania. Trichotillomania, it is disorder of desire. On the practice, we will talking about what is it trichotillomania. Next, gender identity disorders. It is, I don't remember her name, it is he, she, very famous singer, was demonstrates one song on the intervideo, yes. Transsexualism, desire to live and be accepted as a member of the opposite sex, usually accompanied by a sense of discomfort with anatomic sex and a wish to have hormonal treatment and surgery to make one's body as congruent as possible with the preferred sex. Now, for example, if he is man, he has discomfort with his anatomic sex, man, and he try to change his body on the woman body. It is transsexualism. And he agree to have hormonal treatment, maybe all life continue to the death, and take surgeries, operation to change body, and become, after consultation at the psychiatrist that he has not schizophrenia and other delusion disorders, he get certificate. For example, he has not severe mental disorders. He go to the surgeryist, demonstrate this blank, and then operations change body, change on the woman body, and then treat by hormones and continue to live as woman. It is transsexualism. And opposite, when she is woman, but she cannot live with this anatomic sex of woman, cannot, because she has discomfort, and she decide to change body on opposite. She go to the psychiatrist, take permission, she has not any mental disorders, go to the surgeryist, then change body on opposite on the man body, and take hormones and continue to live as man. It is transsexualism. No, what, for example, for this diagnosis must be this discomfort, signs of this behavior must at least 2 years. Usually we have in our consultation meeting, for example, when they come visit our psychiatric hospital, we call a commission, consultate them. Usually they come to us after not 2 years, after 3, 4, 5 years, and so on. And they cannot live with their anatomic sex. Так, exclude, you see, we exclude schizophrenia and other mental disorders. And now in the medicine, we cannot explain with what factors, concrete, clear factors, depends this formation of transsexualism. Cannot understand, cannot open this etiological factors. Maybe combination, maybe genetic problems, don't know. Так, dual rule or transvestism. Transvestism, not transsexualism, you see transvestism. The wearing of clothes of the opposite sex in order to enjoy the temporary experience of membership of the opposite sex, but without any desire for sex change. Now you see what they on the picture, they are men. Only temporary they clothe the woman dresses, and only some hours they become as women. They have experience as women, opposite sex, but in life they not, they don't want change sex. Так, you see fetishistic transvestism, you can read in the internet what is it and so on. Next, gender identity disorder of childhood. Manifestation during early childhood or usually before puberty, but sometimes we notice during childhood when child, for example, 5 years, 4 years, 6 years, try, for example, if girl, the mother, father cannot dress by, if girl clothes, for example, this a child want to clothe boy clothes and ask to buy the boy clothes and so on. Play in the games of boys, for example, really she is girl. Characterized by persistent and intense distress about the same sex together with a desire to be of the other sex. For example, if girl, I repeat, she play in the game, boy games, she dress with clothes, boy clothes, and so on. There is a persistent preoccupation with the dress and or activities of the opposite sex, or repudiation of the patient's own sex. Так, it is what problem. Then, after when they become adult, we usually would maybe see transsexualism, maybe some of these children become transsexualism suffering, and then change, some of them change the anatomic sex on opposites. But in the life they have problems. Yes, some of them has depression, some of them has suicide behavior and so on. It's very difficult. And then formation tendency, maybe so homosexual tendency. Maybe you know now in some countries it is official order, the marriage between two men or between two women, for example. It is lesbians and homosexualisms. Так, now we finish chapter F60, 69. It is all topics. Please learn and answer on the class. Goodbye.